When you were dating and like females know that you have seizure problem, did they discriminate any at all?
No, one and two of them will do that, And you have people take it cost me. And when I've done died, I left and the seizures.
Okay, that didn't have any chronic illness.
Right.
Okay, so you're still able to live
But a happy life.
happy life.
We have is to encourage the person who have a seizure. Don't climb a tree, don't go up on a building too high, because you don't know when it won't give you any warning.
Yeah.
Just attack. Do certain things. You try to protect yourself from certain danger.
Oh.
If I don't give you any warning, I don't know when it happened, I just sleep. I'm gonna wait. Say, that's what's wrong. That's what's happening. Because 289 3247. And they call him Moses.
Moses, and you sell jelly.
Yes.
Alright, that will be increase the sale. Alright, so Moses.
In Office with Dr. Jevon Samuels.
Welcome to another episode of In Office. I am Dr. Jevon Samuels. In Office is a program which we talk about life, sickness, and death. And today in office with me is Mr. Dennis Robbins. He's here to share his story about seizure disorder and how it has been affecting his life. Welcome to the show, Mr. Robinson. Alright? So before we get into the interview, I'm just going to give a brief overview. So seizure disorder is basically a disease that is characterized by the abnormal electrical activity in the brain. Right? So remember that how the brain works is that it's just a set of what we call cells, neurons, which similar like wires, and they basically transmit information from one cell to the next via electrical activity. Right? You have certain types of substance in the brain that cause excitation, and you have certain substances cause it to inhibit the activities. Alright? So when we have a seizure, it's basically malfunction cells in the brain which are either not being inhibited properly or they are overly excited. Now some of the symptoms of seizure, obvious ones that we would see is stiffness, which is normally called tonic, and then we have the clonic phase of the seizure, which we have the rhythmic jerky movement. So seizures normally can be very dramatic, normally includes loss of consciousness, so the patient will suddenly lose consciousness, limbs stiff, and jerky movements all over, right? And then normally you have a post-ictal phase after the jerky movement. This, however, is just one type of seizure, which is called a generalized tonic-clonic seizures, but you have several other different types of seizures which are more subtle and are not so dramatic. Like some persons may just have a absent seizure in which they don't, they just basically have a blank stare, or they just lose focus for a couple of seconds. Now, in terms of the causes of seizures, normally sometimes you have the causes unknown, but for example in children you have febrile seizures in which if the baby have a temperature which is very high, then they can develop a seizures. But in adults, it normally we don't have a specific cause for the seizures, but however, some cases the seizure may be triggered by a brain injury, such as like a motor vehicle or car accident in which you have damage to the brain. Then you can develop a seizure from such trauma. You could also have some patients may have a brain tumor, that brain cancer, and which can also cause seizures to develop. Right? Now you also have like electrolyte imbalance, such as the electrolytes in your body, like the potassium or the calcium, maybe higher or low. Those can also trigger seizures. And common substance in persons with diabetes, especially when they're on insulin, and some persons may go what we call hypoglycemia, low blood sugar, that can also trigger a seizure as well. And you have several other causes of seizures, which I'm going to delve into all of them in this interview. But some of the important things from the public that should know about seizures is what to do when you see someone having a generalized tonic-clonic seizure. So the persons lose consciousness, they're stiff on the ground, jerking, and maybe frothing at the mouth. Some have eye rolling, some may have a urinary or fecal incontinence, etc. Some may have tongue biting, some may have bleeding from the mouth. Now, it's also essential to ensure that the person airway is secure. If you observe someone have a seizure at home, you should, or even on the street or in the workplace, you should quickly turn them on their side and ensure that no object is in their mouth or they're not obstructing their flow. All right, and also, if possible, try and seek medical attention as early as possible. But it's also ensure that when you are moving the person, ensure that you don't allow them to twist and make it awkward that may actually obstruct their breathing pattern. Alright? And so a seizure may look dramatic, but it's also important that you should keep your calm and just try and stabilize the patient, lean them to the side and just observe the seizure for a while. Because normally most seizures will tend to stop within a minute or two, right? Or we have some cases in which the seizures last for a long period of like 10, 15, 20 minutes, and we call this type of seizure status epilepticus, which can cause severe brain injury. Alright? Status epilepticus is also defined by recurrent seizures before the person will come back to baseline. So it might be in the post-ictal and then they have another seizure before they revive and gain consciousness. Alright? But these are some other types of seizure. I have several different types of complications of seizure, and my guest here will delve into some aspect of how I've been living with seizures for a while now. Alright? Once more, Mr. Robinson, welcome to the show. Alright?
Yes, sir, thank you. Yes, sir.
Alright, so at what age were you diagnosed with seizure disorder?
I'm not directly say about 12 years old.
12 years old?
Roughly.
Okay.
And I have it quite often, quite regular during that young stage growing up. Going to school, through school I have it sometimes. A doctor called Dr. Magnus who prescribed this, he called it epilepsy first. And he told me that I must go less to school because I'd be dropping out in the classroom and the long way. And so, but since I've grown up to be a young man, doing some trades and activity and all of that, it just happened now and again. Sometimes twice a month, sometimes since I'm growing up to be like over the 50s growing up, it tends to happen like once a month, sometimes every 3 months, sometimes even 8 months period.
Okay. Right. So what type of symptoms that you have during the seizures, like a jerking, lose consciousness?
I don't have the seizure. I don't have the jerking. I like, a doctor told me that after this system knock off the brain, the brain knock off, so that's when I fall to the ground. So when I fall to the ground, the problem, I don't have the jerking and the head lifting and fall. That's the only thing if you have a fast sleep, but push out the back and the leg.
Okay, so it's just that you just lose tone, like your muscles become weak.
Right.
You also lose consciousness, like you're not aware of surroundings.
No, I will sleep, I don't know how long, I don't know. I know people always put it together, but I don't know how long I sleep for, but after I sleep and come out of it, I can go back to work every time.
Okay, so do you normally bite your tongue?
No.
Do they say have an eye rolling?
Yes. I can't
rolling eye. No. What about like urine, like you urinate of yourself fast too?
For the last time. About the last Sunday last year, December, I have it in church. It attacked me in church.
Okay.
And I find out that I went myself.
Okay. So what are some of the medications that you've been using for seizures?
I've been taking medication from my mother child for it until now.
Okay. So
like now, in my age now at 68.
Yes.
I have it like I told us December gone.
Yes.
But I don't know how far down the road it will happen again. But I'm still taking medication. And it's the first I've been having it. I've been taking some capsules.
Okay.
For it. And there's some white chart to them.
But tell us about your high school. You went to high school, right?
No, I didn't reach high school.
I didn't reach high school. So you had the seizures from you were going to primary school?
Yeah, from
so how did it affect your school, your time at school?
Well, it slowed down the time at school, because everybody know that and teachers know that I have trouble reading.
Okay.
So I've been in and out of school. Even when I'm going to school sometimes 2 weeks, I leave after school because within that 2 weeks, you can pass through.
Okay, have a lot of seizures.
A lot of seizures. But growing up to be a young man,
Yes.
like from the 20s go up.
Yes.
Yeah, from the 20s go up to my age now.
Yes.
They have it quite a little bit less.
Less. Okay. So what type of work were you able to do?
To do?
Yes.
Well, I usually do mechanical work, do good body works and so on. I never used to go up and go high.
Okay.
And I remember the last place I worked was in Jamaica Flour Mill.
So what type of work are you doing at the Jamaica Flour Mill?
Like, assistant, like, in the engine room, like, we assist the workers in there. Not much time I spend in there because you know the complaint I have.
Yes.
I'd stay away from certain areas.
Right. So in terms of finding employment with the seizure disorder that they have, so if you go to like an interview for a job and they know that they have seizure disorder, do they discriminate, like use it against you?
Yeah, and most of them don't give me any work. You have the seizure, and I don't hide it from anyone.
Okay.
And like from 1980, I'm not doing work for anyone.
Okay.
Ignorant
Okay.
from the living.
So like when you were working at Jamaica Flour Mill, so do you ever have a seizure episode on the job?
About 3 times.
You can discuss one of those times with us, like what the co-workers did.
Because the first time it happened, I usually tell them about it. So when it happened, it's like they were looking for it.
Okay.
They were looking for it. So they always protect me, put me in an area where I don't go up and know anything to work.
Yes.
I'm always on the floor. As if you take me, I just fall to the ground. Right now, to tell you, I have this pain in the shoulder. And I don't sure if I'm like, the last 2 times I have it,
Yes.
I have it in the marketplace. I feel like I hurt the shoulder and the pain is there. I can't lift it up more than I don't feel the pain.
Alright, in my introduction I had mentioned some possible causes of seizures like a brain tumor or previous head trauma. Did you do a CT scan of the brain?
Several times, but I cannot explain the result from the scan.
So they said that it was abnormal or normal? I can't remember. Now normally sometimes we just say, oh, the brain scan is normal or it's
The
abnormal.
one I've done the other day,
Yes.
I don't have no
Results.
No. They don't give me a report on the CG. I have no time.
Okay, so the medication that you have been taking, you know the name of the medication?
No, that's why I cannot identify.
But how often do you take it and
Well, this one that I'm taking now for the medication, for the, on behalf of the seizure, I take 3 of the little capsule. Once every night going.
every night go to bed? That sounds like dilantin. And so do you take it every night?
Every night I take it, to last night.
Okay, so and even when you're taking it every night, you still have the seizures from time to time?
Sometimes I wonder within myself what trigger off it while I'm taking the medication.
Okay.
So that's why I said to you that at my age now, probably it need to be upgrade or something from that time till now. I was even thinking that the amount of treatment I take for it should become cure.
Okay.
Cure. But I don't know.
Okay. So
And I'll have to, and even in my growing up age, I go for when to water for that tank,
yes.
to go water. And there are some places where the water is in the earth.
Yeah.
And go for the water, and I have no time, and I have any problem.
Okay.
See that don't trouble me, and I do it the other time. The bush will look good and tell me good and all of that.
So
But there are times when it does not go.
okay. So what about like beach and pool and rivers? Do you go to those
I went
places
to the beach.
and swim?
No, yes, but not regular too. I know I have it.
Okay.
I just don't take it as a habit. And river, I don't have any access to river.
Alright, so in terms of your social life now, were you able to actually get married, have a family?
Yes, I do. I have a married from a wife now.
How many children?
Roughly 7 children.
7 children? Good. So you did.
I get twin 2 times.
Okay, so even despite the seizure, you're still able to live a normal, fulfilling life.
Right.
Alright.
Right now, my 2 last child.
Yes.
Can't record. The 2 last child, one now is in Canada.
Yes.
And very last one, she is a nurse at UA.
Alright, so take me back in your younger days when you were dating and like females know that they have seizure problem. Did they discriminate any at all?
You know, 1 and 2 of them will do that, you know. And you have people take it cost me. And you know, when that then died and left and the seizure.
Okay, that didn't have any chronic illness.
Right.
Okay, so you're still able to live a
But a happy life.
happy life with the seizure.
Right, because right now I'm married and live with a nice woman.
Yes.
In the market right now.
Yes.
I would like to go and see her before I get divorced.
Okay. Alright.
So,
Alright, so
in a good life.
okay. So any tips that you don't want to share with someone that is living with seizure disorder and unable to cope?
Well, the tips I only have is to encourage the person who have the seizure. Don't climb a tree, don't go up on a building too high, because you don't know when it don't give you any warning.
Yeah.
Just attack. Me use a bit of cut jelly, and many people tell me that they will see it like they throw it out of my hand. When I go drop,
Yeah.
open my hand and it drop one side.
Okay.
It never hurt, it never cut me. One time, it gave me a mark over here.
Okay.
One time. And it's about 2 last times in the marketplace.
Yes.
So if I can get something, keep it away.
Yes.
Not even so, you know, it's not going to cure because it should have cured by now.
Yes.
But just to keep it away, you know. Sometimes they are 6 months or 8 months. I got to wait till December gone.
Okay. Alright.
So I'm looking to well, probably the next 5 or 6 or 3 months.
Yes.
Okay, would I have it again? Anywhere, anyhow. Even, I can remember it one time, I was living in Bagwan.
Yes.
I was traveling from Bagwan to come to town.
Yeah.
Come to business. Take me on the bus.
Okay. So the other passengers in the bus are scared?
They're scared and some put me up because some people understand what it is like.
Okay.
You know?
Alright, so on the road driving, were you able to get a driver's license?
No, I didn't, because when I was growing,
Yes.
my mother and my brothers and sisters said must drive.
Drive. Okay, good.
So I take that off the map.
Off the map. Okay. Alright.
And I can, you know.
You can drive, but you
I
don't.
can, but I don't do it. Because I tell you that it's some mechanic work. You usually have to be around motor vehicle,
Yes.
body works and all of that. The driver was coming in with this morning and we were talking and he said, but you have good idea about mechanic. I said, yes, I usually do it.
Okay.
Yeah, man. So just don't do certain things. Just try to protect yourself from certain danger.
Okay.
If I don't give you any warning, I don't know when it happened, I just sleep. I'm gonna wait. That's what that's what happened.
So part of this program is like if the person needs any assistance or if they have a business to advertise, they can go ahead and share it with the public because it's gonna be on the internet and the whole world will see this. But
Of course.
so you can what type of work you do now?
I will eat like, I sell jelly.
Jelly. So where do you sell jelly?
Nobody permission.
Coronation Market. The number you want to share with the public, they can call if they want the jelly.
Yes, man.
Alright, go ahead and tell him your
My
number.
number is 289-3247. And they call him Moses.
Moses, and you sell jelly.
Yes.
Alright, I hope you increase the sale. Alright, Mr. Moses. Alright, viewers, remember to share, like, subscribe, and leave a comment on this video. Until next time, for more informative medical content and life sickness and death, stay tuned. Thanks very much for coming again, Mr.
And I appreciate that.
Yeah, man, good. All right.
Be sure to subscribe for more informative content on life, sickness, and death.